An excellent joint mobilization for the rib cage can be performed with the client lying supine. Marianne, I'd like you to scoot over toward me on this side of the table so I don't have to compromise my body mechanics. That's great. Bend your left hip and knee and put your foot flat on the table. And now I'd like you to cross your hands to your opposite shoulders. And we'll do that so that her upper extremities are parallel with each other, forming a V here. Okay? Hold on with your hands. Other than that, relax. Okay? I'll roll you this way. You will not fall off the table. Now I'm going to take my hand and place it into a gentle cupped fist, and I'll grab on the tissue, and then I'll do a tissue pull inferiorly, so I take out any slack in the tissue. I place my hand on your upper extremities in front, and I'll place your elbow in against my xiphoid process. Take a breath in. And as you breathe out, I'll just gently roll you onto my hand. Just like that. Take another breath in. I'll tissue pull down a little lower. And as you breathe out, I'll gently roll you onto my hand. One more time. Take another breath in. Tissue pull even a bit lower. And breathe out. And I'll gently roll you onto my hand. Just like that. It's very important when performing this mobilization that no fast thrust is introduced into the protocol. This mobilization, as demonstrated here, is a grade 4 joint mobilization. A fast thrust would turn it into a grade 5. Taking a look at the posture of the client's upper extremities, they're crossed, hands toward opposite shoulders, but they're crossed where the arm, forearm on each side are parallel with each other, forming a V. And if I'm standing on her right side here, then it's her right upper extremity that's lower than the left upper extremity. Taking a look at mobilization of the rib cage with the client supine using a skeleton, we have the padded board on the table. We have the client's, in this case, left side hip and knee joint bent with their foot flat on the table and their arms crossed to their opposite shoulders. We bring the client over. I place a comfortable open fist against the angle of the rib cage. I place the elbow in against my xiphoid process, and I rock my body weight gently down onto the client. I pick another contact point, and I take a tissue pull down to take the slack out from the skin, and I'm again on the angle of the rib, and I rock my body weight gently down onto the client through their chest onto my hand. And that's mobilizing the rib cage with the client supine.